This is a conversation, and it's a conversation because all boats float on a good tide. So the more we share, the open we are as business professionals, we will grow and get better and stronger and succeed together. So my name is Lori Power, and I'm a group benefits specialist. Let's start today. Louise, tell us a little bit about your background, how you got involved. What is a physician assistant?
Hi, welcome. So a physician assistant is really a misnomer. We don't assist physicians, we don't assist doctors. We're more of a physician extender. So we train under the physician route as opposed to a nursing route. I did go to medical school. I graduated from Nebraska University with my degree in physician assistant. And I did that through the military. I was a medic for 17 years before becoming a physician assistant. And basically I work under what physician I'm working with. I work under what his scope of practice. So basically we can close a surgery, but we can't open a surgery. And we do everything in between, from just treating people for ear infections to doing complete medicals for employment or yearly health medicals. We send for diagnostic testing, and we come up with treatment plans, and we really extend what a physician can do.
Excellent. So tell us a little bit about your background in the military and how you get started with Canada House Clinics.
So I spent 18 years in the military. I did 2 combat tours to Afghanistan and 1 tour to Bosnia as a medic. So I have lots of experience in the medicine world. And when I was getting ready to transition out of the military, I had a very good friend who was in the cannabis industry. He was an educator, and he knew how much I liked working with veterans, and anything that I can do to promote veteran health, I'm really interested. So he asked me if I would like to come and work at his clinic, which I did, and I gained tremendous experience and knowledge working with other educators. And I took a course on cannabis from a nursing school in the States. And so I did that for a while and absolutely fell so passionately in love with cannabis and how it can help our veteran community and how we can help civilians, whether they're in pain or whether they have mental health concerns. And so I did that for a while with them. And unfortunately, that company ran out of money to pay me. So another friend of mine at Canada House, he had posted that they were looking for somebody. So I went in and spoke with him. And I've been working there since it was a year in July.
Wow, yeah. Congratulations.
Yeah, it's been a wonderful, wonderful year.
So Jessica was telling us prior to the show that Canada House Clinics was renamed a couple of years ago, and the clinic has been open. I'm just going to interrupt for just a quick second. Jessica, the clinic's been open for 4 years under Canada House, or has it been longer?
We will be going on to year 2 as Canada House Clinics on November 1st.
Okay, and then 4 years you've been open?
No, we've been open since 2013. Our very first clinic would have launched in Armagh, New Brunswick. Fredericton is where we kind of were. We were working out of a home, and then we ended up opening a clinic, and we've been open since 2013.
Perfect. Louise, tell us a little bit, some of the basics for those that are of us like me who are ignorant in the room. Tell me some of the more common ailments and treatments that you see on a daily and ongoing basis.
Right. So one of the major concerns that we see is people with chronic pain, whether it's arthritis pain, whether they've had back injuries previously, and as we get older, we minor injuries from our youth start to become major injuries and cause, you know, considerable pain as we age. So I see a lot of people with chronic debilitating pain where they've really tried, you know, all sorts of pharmaceutical medications. And, you know, they've been taking them for years, not really getting good effect. They've been doing physio for years. It's not really helping anymore. And they come to us, you know, sort of like when they've tried everything, right? So pain is a big one. We also see a lot of mental health concerns. So we do deal with veterans, a lot of veterans, and they often come with PTSD, high anxiety, and depression is a large part of it. And so we treat people with mental health disorders and chronic pain. Those are basically the two big ones.
When we're talking about, now my mind reels, as you know from us chit-chatting before, in a number of directions. So Chandra had put up that, you know, she has fibromyalgia and she utilizes medical cannabis for the treatment. Tell me why medical marijuana versus more traditional pharmaceutical. Where's the advantage, perhaps some of the disadvantages of one over the other?
So most pharmaceutical medications, almost all, are created in a lab, and they're compounds of different elements put together, different products put together. And oftentimes medications are created for one particular ailment, and then as an offshoot, they find out, oh, but it's helping for another one. So we call that off-label use, where cannabis is a completely natural occurring plant. It happens naturally in the environment. So there's no real processing. There's no chemicals that are going into it. It's a nice, pure product. So that's really the advantages.
Why is there such a blowback then, Louise? It's been legal in Canada for such a long time. And it's amazing to me. I know when they legalized it for recreational use, one of the first things I did was take a tour of the facility, Aurora, here in Edmonton, because really it's important that we be educated and make informed decisions. So why does there continue to be that stigma associated with anything marijuana related, especially when it comes to the medical field, and for how long it's been available here in Canada and the proven track record?
Right. So most people, the experience they have with cannabis or the experience that they're aware of is people getting high. You know, we think about teenagers smoking it and getting high. So when we have somebody who's never been exposed to cannabis and all of its benefits, then that's all they think about. So when you suggest, perhaps, I mean, and this happens to me every day when I talk to brand new clients, and we'll talk about CBD and THC, and they go, oh, no, I don't want to be high. You know, and that's their reason for holding back on coming. And so having to explain that cannabis does not mean that you're going to get high. You know, that's not what it's for. That's not our purpose. Our purpose is to help you. And so having to explain the difference between CBD and THC, and also explaining that small amounts of THC are very good for pain, and they help you sleep, and you don't have to get high. So that's the biggest concern. People think that you're going to get high, you're going to get addicted, and you're going to become a junkie, right? And nobody wants that. Right?
No,
so it's through education that people realize. Yeah.
What is the difference between CBD and THC? What's the difference? The THC is the psychoactive quality, is it?
Correct. So CBD is a very good pain reliever, anti-inflammatory, and it has these wonderful mood stabilizing qualities to them. Where THC is a very, like, it's a better pain reliever, better anti-inflammatory, but it can give you those psychoactive properties where you can feel the effects in your mind. So those are the main differences between them.
Give me some examples, if you would, of where you would use one over the other and how you would dose that out for a particular patient.
So for people who have chronic pain during the day, so arthritic pain or bad back, any sort of musculoskeletal pain, I always recommend CBD during the day. Most people are employed, they drive, or they have children, or they're in charge of children, and they can't be utilizing anything that's going to give them any sort of mental confusion or give you that high. So CBD, like I say, is very good pain reliever, anti-inflammatory. So I recommend that for during the day. There are times where THC, a small amount, is recommended for people who are in debilitating pain. So somebody who has pain from cancer, that, you know, it happens where, you know, it's not all day long, but there are times where the pain is very severe. A small amount of THC can really help get that pain under control. And the effects that it does have on your mind and your body is that it relaxes you, you know, so the pain is not the forefront in your mind. It actually helps with decrease the pain and makes you more comfortable. So there are times where I recommend a small dose of THC during the day, right? But mostly THC is used at nighttime, and we use it because it is a better pain reliever and anti-inflammatory. So when you take it at night, you have that anti-inflammatory properties working all night, so you actually wake up feeling better. So, and THC, provided it's an indica, will help you sleep. And a lot of people complain that the pain wakes them up in the night. If they roll over, then it's a sharp pain and they wake up, and then they're awake for several hours. Where THC, most of my clients will say, if I do wake up, I'm easily able to roll over and go back to sleep.
Well, we're none of us getting any younger, and I can tell you a good night's sleep is well thought after.
Yeah.
I want to take a moment. I'm going to get to your comments here, Jessica, so just give me a brief second. But I was speaking before we went live here about my folks, and one of the things we do want to do is dispel myths. So, you know, I have siblings, and they are utilizers in a recreational manner, but in order to keep mom and dad at bay, it's like, oh, well, this is, you know, medical mom, it's prescribed, I'm okay. And that causes confusion out with people who haven't taken the time or the energy or effort to educate themselves. And that was one of the questions that I asked you, Louise, when we first got together. What does taking medical marijuana really look like today? Is it the joint? Is it the oils? How is it prescribed? And what does that look like? And you had such fantastic insight on that. Can you share a little bit?
Yeah, so nowadays the idea of just smoking a joint is, you know, probably the least way I prescribe cannabis to people. Oils are a wonderful way to go. You put it under your tongue, you hold it for a few seconds, and it does take about 45 minutes to an hour to start working, but you get very good long-lasting results when you take the oil versus smoking. Smoking, you get very quick results, good results, but they can wear off in an hour. So if that's the way you want to consume it, then you're using it multiple times a day. Where when you take oils, because they do last so long, you're only taking it twice a day, perhaps 3 times a day if your days are very long. But we also have now soft gels. So you can get your dose in a soft gel, and very discreet to use. If you're using CBD at work, you can, you know, nobody is ever concerned when they see someone taking a soft gel. And again, you get that nice long-lasting result. And now we have the vape pens, which, you know, a lot of people are still concerned. We're hearing all the stories out of the States of kids dying from using the vape pens. And really, I believe, and Jessica can confirm if for me, it was vitamin E that was in these oils in the States that kids were inhaling and causing lung damage. And that's not what's being used in the oil pens at all. So again, it's very discreet. They come with a little battery. It looks like, you know, there's different shapes, but it basically looks like a pen. And you push a button and it heats up the oil, and you take a couple of inhalations, and there's no smoke like when you're smoking a joint. There is some vapor, but it's not that big, and there's no, it doesn't smell the same. So again, you get a pretty good quick onset, and it's long lasting. So there's a way to consume it for everyone.
For my world, in looking at employee group benefits, one of the items in order to have something covered under the benefit package in the pharmaceutical, we need a drug identification number. And that has been a real downfall. I mean, we're able to have it covered under a health spending account, which is great. We have an avenue to have it covered. Most of the carriers will provide it according to disease category or illness. But where do you see the hang up from Health Canada, just from your own perspective, on issuing a drug identification number in accordance to how it's being dosed out? Because obviously you're dosing a certain quantity and a method of usage. So how close are we to getting that drug identification number, if you know?
You know, I don't really know how close we are to getting it, but I do know that while we have a lot of good evidence and like 10,000 years of proof that caveman was using cannabis for medicinal purposes. And, you know, like I said before, we have like 6,000-year-old Egyptian hieroglyphics of the cannabis plant. So we have a lot of anecdotal evidence, and we have a lot of evidence based medicine results that it's beneficial to people. But there's not a lot of hardcore in-lab testing done. And I believe that as that becomes more available, there'll be less and less of an argument to not come up with a DIN number.
Well, it just seems to me, and I know Bob and I have talked about this as well in a couple of the sessions, if this has been legal since the 90s, my goodness, they're certainly taking their time getting a drug identification number so we can get it covered under the benefit plans.
Well, without the good science, there's not a lot of money. So there's not a lot of reason to study it. So now that it's become more mainstream and more people are using it, now that you see more dollars going into research, and as that research becomes more available, it'll be hard not to approve it.
I agree.
Insurance.
I absolutely agree. Jessica, can I call on you and take us through some of your comments here? I thought they are very worthwhile to share.
So just the past year, I've been going to upgrade into a herbalist practitioner, and a part of that course is we do a lot of herbalist history. So it goes back as far as 30,000 BCE, and it's all about plant medicine. And it starts to go into the part where here in North America, we started to transfer into the pharmaceutical industry. And we got to touch on a lot of aspects of pharmaceuticals, you know, where were they coming from? And actually a really great analogy that they utilized in an example was Pacho. So if anyone knows what Pacho is a tree in China, and there were about 27 different isomers they found in this Pacho plant. And the Chinese were utilizing Pacho along with chemotherapy, and were having 100% success rate of completely eliminating cancer. So here the pharmaceutical industry went and took Pacho, broke it down to its 27 isomers, did research on every single one, found the one that had the best chance of what is actually causing the cancer to eliminate. So they singled it out, patented it, recreated it in the lab, and then when they went to go administer it in research, it actually ended up stopping the heart of multiple people because it was completely eliminating potassium out of the human body. So what was that theory that it came down to is when it comes to plant medicine, it's not just, you can't just go into a lab and recreate one little piece out of the plant in order to do what you need it to do. The reality of it is that there are hundreds. Some plants, like the cannabis plant, have thousands of different aspects in it that are working together to give you the effect it does. And it was a really large eye opener to me because I realized when I went back, here we've got Nabalon, we now have T-Vex. These are all cannabis derivatives that the pharmaceutical industry is making millions and billions of dollars off of. I have a patient come in, tell me they take Nabalon and they feel drunk and they feel dizzy. I've never had a patient come in here and tell me THC oil has done that to them. So what is it that's the difference? It's because you need the plant and all of its components. And it's kind of like a dirty back world that you realize, oh, they really can take that isomer, they really can patent it, and they really can turn that into a multi-million-dollar medication. Put all the money into that research to make it look like it is something very appealing. You will always see from the beginning of time when I've done this course, that pharmaceutical industry will attack that plant industry. Then the plant industry will make it on top, will crash again, will be on top. It's been the pattern throughout the beginning of time that we will always fight each other. Plant medicine will get its time and will get shut down again, and we'll be back again.
Well, it seems to be certainly gaining power now, and that's a good thing. So that takes me to the question, Louise. Take me through a patient coming in the door for the first time. Let's dispel that myth that I hear over and over again in the benefit world. Oh, I only just have to ask my doctor and I can get a prescription for medical marijuana and I'm off to the races. So it really isn't clinical. And, and those of us who take the time to find out about the process and the application, no different. Walk us through what that looks like with a patient.
Yeah, so, we have people, I have people reach out to me all the time and say, hi, can I get a prescription? So then I point them. The first thing you need to do is, you can register with Canada House Clinics and you'll get the referral form. You need to take that to your doctor and get your doctor to fill it out. We work hand in hand with your primary care practitioner, so they're aware of the treatment that we're recommending, and we're aware that they've sent the referral to us. So they're aware the client is going to be taking cannabis, and we confer with the doctor of what our plan is with the patient all the way through. So you can't just come in and say, hi, I'd like a prescription. It doesn't work that way, right? And Canada Health would not allow it to work that way. It is a very, a very specific route that you need to go. And we do get patients whose doctors do not agree. I've received letters that will say, this is my patient has this diagnosis. They would like a referral to cannabis treatment, but I don't necessarily agree with it. And that's fine, as long as we're working together. So they know their patient is coming to see us, and we let the doctor know what the treatment we have planned for the patient.
And that alignment and team approach to better healthy outcomes, isn't that what we're all looking for?
Absolutely. Yeah, we're not a single entity onto the side that, you go see your doctor for all your medical health, but then you sneak into the side and you get cannabis from us. No, we're on board with your doctor is on board with us. So it is.
You did have some really good analogies, or you had some experiences where cannabis does work well, and then when it doesn't. So let's get both sides of that balance beam and talk about that experience that you've had.
So my days are filled with, when I do renewals, when they come and they say to me, what a difference. Or, I'll ask them, okay, but what about this pain? And they say, oh, I forgot about that. No, I'm not experiencing that. Or my pain is such that I'm not taking Tylenol or Advil, 6 times a day or whatnot. So we see really fantastic results. And I think one of the stories I'd mentioned was, it was a widow. And him and his wife used to work in the garden, and he had developed Parkinson's so bad, and he was shaking so bad, and his wife passed, and he hadn't been able to go in the garden. He started taking CBD twice a day, and when I saw him again in 3 months, his shake was almost gone, and he said he was back in his garden again, tending to his wife's flowers. So, that's very inspiring. Those are the kind of stories that make every day wonderful. But there are those people where they try CBD, they increase their dose, we'll try a different provider, maybe a different carrier oil, and they get nothing out of it. And I can't really explain why they don't get much benefit out of it, if any benefit, but where all our bodies are different, the cannabis affects each of us differently, medications affect each of us differently. So there are people where it just doesn't work. And I hear the frustration in my clients when they say that, and I feel their frustration when they've heard all these wonderful things and they've been referred because a friend is taking it for the same ailment and they feel great. And it's just really unfortunate, but it is not the magic oil that some people are hoping it is.
And it works important to point out that, it's those same people, it just wouldn't work for them for cannabis. There would also be a blockage if it was big pharma as well. So
correct.
This is the treatment plan. Lauren had a question, and I think it's an important one when it comes to employers. If an employee is prescribed CBD only, can an employer be confident that there are no safety concerns with the employee taking CBD?
So if CBD is taken as prescribed, and it is a CBD that is extremely low in THC, because it is coming from the same plant, so you can't get 100% zero THC. There's always going to be a small bit of remnants, but provided you're taking more CBD than THC, you should not feel any of those psychoactive properties. And especially if you're using a very high concentrate CBD with that proverbial drop in the bucket, there should be no safety concerns. And you can feel confident going to your boss and saying, I'm consuming THC. It's been prescribed for me by a physician. Here's my prescription. And then right now the laws in Canada are a little gray in that area. And I know there are a lot of lawsuits going on right now that people who are being prescribed CBD, their job is saying, well, you can't work here. And
they're losing though, Louise, which is the
yes.
big thing. The courts are finding in favor of the employee. There was the most recent one I read out of Newfoundland where it had passed the lower courts in favor of the employer, and the employee continued on through the union with the union support, as I understand it, and then went and won the second round in favor of the employee. So it is, I think that brings us and loops us to getting that drug identification number, getting more recognition, understanding that the courts are looking at this. I wouldn't say they're blind, but in a favorable method, as to say, we understand where it's been used and how it's being used. And so the employees who have needed to challenge it are coming out on top of that.
And that's so wonderful. That's going to help a lot more people. And a lot of times people don't you know, even with my clients, and I'll say, do you have any questions for me after we've talked for an hour? And it seems sometimes their head is just spinning and they go, I do, but now I can't think of any, you know, and that's fine. I always tell them, email me later, you know, when you've had time to process this and you wake up tomorrow morning and you go, what did she say about that? Just go ahead and email me anytime.
I have a question.
Sure.
So if people are taking this for, say, chronic pain or actually inflammation, does it have the effect where it would reduce inflammation in the body?
It
And then
does.
there's so many diseases get worse with the inflammation.
Absolutely. So that's why I really recommend when you start taking CBD, it's not to replace like Tylenol or ibuprofen or Advil where you take it when you've got a lot of pain. CBD, you really need to take it every day, twice a day, if that's what the treatment plan is, regularly. Don't stop taking it because today you feel good, right? What we're trying to do is stay on top of the inflammation and stay on top of the pain. So we just take it twice a day, regularly, hopefully around the same time, and we'll stay on top of that inflammation.
Chandra wants to know, what has the impact of recreational cannabis had on the medical cannabis? Has it been positive, negative? What's your generalized impression of that?
Well, I don't have a lot of experience in the rec market personally, but what I find is the people that are coming to us, a lot of them are people who have never actually utilized it before. And so they know this is through their doctor and with their doctor's input, and they're coming in to see, you know, they're coming in to see me, and they trust that they're getting all the information. And one thing I make sure that all my clients are aware of is, you know, if our next appointment isn't until 3 months from now or 12 months from now, I'm always available. You know, we're going to work together. If you have any questions in 2 weeks, you just reach out to me. I'm always here for you. As opposed to when they go into the rec market, they're not allowed to give any information about medical benefits of it. It's illegal for them to give medical advice. So, you know, people will say, I went down and I got a bottle of CBD, but I don't know how to take it. I don't know how much to take, when to take. And so we have that discussion going forward.
I was always under the impression that cannabis was a depressant, and yet it's on here that you use it for mental health. I have a son who suffers from anxiety, and yet because he's in the trades, would you use the CBD, or I thought you said it was the THC for anxiety?
No, CBD.
Oh, really?
Yeah. CBD is a very good mood stabilizer. So it helps reduce those feelings of anxiety, and it helps prevent or reduce the feelings of depression. It's actually, you know, it has that feel good qualities to it. So it helps our veterans tremendously, those with PTSD, so severe anxiety. And what I hear all the time from them is it helps prevent them from getting angry. It helps keep them calm. They're able to go shopping with their families. They're able to go out for dinner. They're able to play with their kids more often. I had one veteran who, he was watching a show on TV and he laughed. And the rest of the family came running because they hadn't heard him laugh in so long. They weren't sure what was going on. And they were like, are you okay? And he's like, looking at them like they were weird, saying, yeah, there was something funny on the TV, but they had never heard it in so long.
But that brings us to time. I always do like to be very cognizant of the 30 minutes, and it is the Thursday Pivot. Now, if you've liked the show, which I hope that you have, and we do this every Thursday for 30 minutes, bringing in an expert. Next week, our expert will be Elke, and she's out of Montreal. And what she does, she traces the customer experience So what a customer sees from start to finish as they go through the process. So I hope to see you back again. And again, my name is Lori Power. I'm so pleased that you come by, and please accept this as my virtual handshake.